my name is Alice Feng from Seattle, Washington. In my research, I learned that before the eligible age to Social Security and Medicare, many remaining in the workforce face declining health and are at greater risk of chronic conditions, impacting ability to work full-time. What is this committee doing to adapt health insurance for this age window and other ineligible, vulnerable demographics?
Well, thank you again for the question. It is a challenge. I've had numerous friends who've been in similar situations where they perhaps retired before they were eligible for Medicare or had health issues. It's largely a federal issue. Medicare is federal, and if people can't work full time because of a partial or full disability, there are opportunities for them to apply early. But the state also offers subsidized insurance for people with low income who maybe aren't low enough income to qualify for Medicaid. I'd be open to suggestions for other ways to address this problem, and it's something we're going to address as we move forward.
Yeah, thank you for the question. This is something that we as a society need to very thoughtfully consider. Yes, you're correct that for many people working in the state of Washington, their health care plans are tied to their ability to work. And as we age, you're also correct that we have chronic health conditions through a variety of factors that are going to increase our healthcare needs as we age. And if for someone that is no longer able to work before they're able to reach Medicare age, that is a huge significant challenge because if you were to buy a plan on the individual market, that would be very cost burdensome. And some people would have to rely on public assistance through Medicaid if they have if they run into a situation like this. So in my committee, we're thoughtful about several policies that hope to address some of those concerns, specifically the gap years before you're eligible for Medicare. But also we've thought very seriously about what can we do as a state in regulating Medicare to make sure that it's better for consumers and better for people across the state. The unfortunate reality to the specifics to Medicare is we're very, very limited as far as what we can do with Medicare plans because those are regulated at the federal level. Something that wasn't necessarily in the healthcare committee but was brought up in the Labor and Workplace Standards Committee this session was Department of Corrections employees for the state of Washington are eligible to retire before they're eligible for Medicare, but many of them continue to work up until the age of 65 in an inherently dangerous workplace where, their chronic conditions are forcing them to continue to go to work. The policy question in this instance was, should Department of Corrections employees be eligible to bargain for supplemental health insurance through their through their labor group? In this instance, it was the Teamsters. Should they be eligible to work with the state of Washington to purchase this supplemental health care benefit to cover them between retirement and Medicare? That bill is continuing to move through the process, but it's a specific example where we, the legislature, get to be thoughtful on the balance between the being eligible to work and having that health care tied to their place of employment. At the end of the day, is it reasonable for all Department of Corrections employees to continue to work to their age of 65? I don't know that it is in every instance. So I think this was a good, thoughtful policy for a very specific group of state employees. That doesn't answer the question of folks who work in the private sector or folks who work physical jobs in the private sector. That's something that we're going to have to consider in the future. How could we expand this specific proposal to Department of Corrections employees to, again, people in the private sector and other industries? What kind of supplemental health benefits could we consider for them to be able to either purchase on their own or purchase as a collective to cover them until they get up to Medicare? So firefighters have the exact same issue, and this is something that we are very thoughtful in our industry. And I'd like to see the examples that we've come up with, or the example that we've set, or what Department of Corrections employees are currently trying to do through their employer and their organizing entity to make sure that those folks are covered. Because, not everybody can physically work up until the age of 65, and that's a huge challenge because we want to have access to care, affordable care, And we want to make sure that people are able to sustain their livelihood without having to immediately go on public assistance. We're happy to provide that, but if it's needed, but at the end of the day, we want people to retain their wealth and use it for enjoying life, family, retirement, all those kinds of things. And that healthcare challenge is a big one for retirees. So thank you for the question.